Cancer continues to bite Kenyan families and their loved ones. Once diagnosed, different treatment options are available for the patient. In this week's Health Digest with Dr. Korir, she looks at chemotherapy for cancer treatment.
In September of 2017, Samuel Kimiti's life changed when he got news that the chest pain he had been experiencing, the pains that could not be numbed by pain medication from his local dispensary, was actually cancer.
Maybe I say according to history, it is only related with death, so I could see my death.
It took counseling for Samuel to come to terms with the diagnosis. During this interview, he had come in for his 7th chemotherapy session.
By that time, I could not differentiate between radiotherapy and chemotherapy, so I thought it is where I'm going to be put under some rays of light.
Chemotherapy is a category of cancer treatment that uses one or more anti-cancer drugs. Chemo, as is popularly known, may be given to cure the cancer, to prolong life, or to relieve symptoms, that is, palliative care.
There are those that are given through the drip, and there are those that are given through tablets. They serve different purposes, and there are over 60 different types of chemotherapies that we use. Each cancer has its own specific treatment, and even within the same cancer, you might find that your treatments are differing.
Each patient coming in for treatment has their regimen computed and tabled on a board for verification.
We compute something called body surface area using your weight and height. We have formulas and applications that we use, and then we multiply that factor by a certain dose that has been predetermined.
During mixing, what we do, we have something that sucks the most of the fumes, because we are dealing with most cytotoxic drugs. The purpose of the sucking is to minimize contact between whoever is mixing and the drugs, because they can absorb even through the skin.
Immediately after application, 1 week, I feel like vomiting, although not vomiting, but my eating is not the normal one.
Hair loss is quite a common side effect. We can get fatigue, we have nausea and vomiting, we have increased chance of getting infections and getting blood clots. The chemotherapy that we're giving to patients now is much better tolerated, and patients are having less and less side effects, especially the nausea and vomiting.
The challenging issues that patients on chemotherapy and other cancer-related treatment go through are not only treatment side effects.
You are employed, so there is this push and pull between you and your employer because you want permission.
Some drugs are costing a few hundred shillings, and some drugs are costing a few $1,000s. So that can really vary the price of certain drugs.
Sometimes you might visit a hospital, you are told a certain drug is not available, go across the counter and get one, and maybe you're financially unstable.
As Samuel's drip of chemo continues, he reflects about people's attitudes towards cancer.
You know, sometimes when you are talking with me, kuna yale macho unaweza kuniangalia nayo inionyeshe kweli wewe unaona kweli ninakufa. If it is diagnosed that you have cancer, it is not the end of life.
Chemotherapy, like all cancer treatment, requires teamwork with the patient and their caregivers at the center of it. Dr. Korir for Health Digest, KTN News.